Hi everyone! Today I'm going to be talking about hemorrhagic strokes. First off, what is a hemorrhagic stroke? A hemorrhagic stroke occurs when blood vessels in or near the brain rupture. There are two types of hemorrhagic strokes, the first one being a subarachnoid hemorrhage, seen here. A subarachnoid hemorrhage consists of bleeding in the subarachnoid space between the arachnoid mater and the brain. With this type of hemorrhaging, about 1/3 recover with barely any symptoms, 1/3 recover with some sort of disability from the occurrence, and 1/3 end up dying. The second type of hemorrhagic stroke is an intracerebral hemorrhage. In this, you are bleeding inside the brain. With this type of hemorrhaging, there's about a 30 to 60% survival rate if caught early. Next, we're going to talk about some of the causes of a hemorrhagic stroke. As you can see, there are many things that can contribute to having a hemorrhagic stroke, including health-related illnesses like high cholesterol, high blood pressure, type 2 diabetes, heart disease, or any other disorders that affect your heart, as well as the use of tobacco, alcohol, and stimulant drugs, as well as some things that we are not able to fix, like a family history of strokes or the natural aging. Now, many of you may be asking, what are some of the symptoms of a hemorrhagic stroke? Well, there are multiple things that could happen when having a hemorrhagic stroke, like a severe headache, the loss or change of vision or blurriness, the loss of balance or coordination, paralysis, passing out, and even a difficulty or loss of speaking skills and seizures. Of course, all of these symptoms do not occur in every single patient and differ between every case, but mattering on where the bleeding is occurring in the brain, you may be affected by one or multiple of these symptoms. Next up, I'm going to be talking about how a doctor can check if a patient has had a hemorrhagic stroke. First off, a doctor will check your alertness, coordination, or balance during a normal physical to see if it differs from your normal activity or capabilities. They will also use a CT scan or MRI, as seen in the image to the right, to see if there's any light gray or white patches in or around the brain, showing a possible aneurysm. Lastly, it's possible that a doctor may look at a complete blood count to see if there's any enzymes that are known to be released when an aneurysm occurs in your blood. So, after finding out that you've had a hemorrhagic stroke, there are multiple ways that you can go about dealing with the issue. Although hemorrhagic strokes account for about 40% of stroke deaths altogether and can easily be life-threatening if not caught early, there are ways of fixing the issue if caught on time. It is very possible that doctors will try to do surgery to remove pressure or prevent it from happening again. As you can see on the right, there is a small tool that they can use to close up the aneurysm and block it from any blood being able to release out of that aneurysm again. It's also important for people to use medications after a hemorrhagic stroke, like blood thinners, to reduce the pressure and lower your blood pressure. Another aspect that comes with strokes is rehabilitation afterwards. Rehabilitation is very important to regain strength, mobility, and function, since many stroke victims are left unable to talk or walk, which also includes going to many of the important therapies that are involved after a stroke, like speech, occupational, and physical, to try and get patients back to a more independent living. Now, although it is possible to survive a hemorrhagic stroke, the best way to live is to prevent one at all. Some of the ways that you can prevent having a stroke is exercising, maintaining a healthy weight, and eating healthy, as well as avoiding tobacco and managing your stress, as well as making sure that your blood pressure and cholesterol is low to lower the chances of a blood vessel bursting. Now, although anyone can have a hemorrhagic stroke, it has been proven that African Americans are twice as likely to have a hemorrhagic stroke compared to any other race. This is because they are known to have a higher chance of hypertension, obesity, and diabetes. It has also been proven that women of color are more likely to have a hemorrhagic stroke compared to white women or men of color. This is because they are more likely to live longer and have a higher chance of hypertension compared to men or white females. Also, as brought up before, people who are over the age of 55 are more likely to have a stroke than someone under the age of 55, and that risk doubles every decade after the age of 55. And also brought up earlier in the presentation, family history does have an effect on your chances of having a hemorrhagic stroke. Now, although these interesting facts may not be fun, I did find them to be quite surprising and fascinating while doing my research. First off, a stroke kills someone about every 4 minutes in the United States, and strokes account for about 1 in every 16 deaths in the United States. Something else that I learned about while doing my research was the idea of silent strokes, which are strokes that occur with no symptoms and are not caught by the victim. These silent strokes are 14 times more common to occur than symptomatic strokes, but can add up over time and have lasting effects on the patient. Thank you so much for listening, and I really hope you enjoyed listening to my presentation about hemorrhagic strokes.